I think the risks of relying too heavily on national guidelines as compared to international guidelines, I think there are four main points that I would like to make. So the first important point is slower adoption of innovation. So what happens is that in many instances, international guidelines can look at a particular disease, a particular treatment, and they can look at it before a similar set of guideline is published in the US. So if we look at international guidelines, we can put it into practice, but if we stick with the US guidelines, there will be a lag period. The second way is there may be limited generalizability and skewed data, because national guidelines are actually based upon a particular country's population and demographics. And so that is going to differ from country to country. Also, the ethnic origins may be different. So if someone is sticking too much to the national guideline, then they are just looking at how a disease behaves in their own population, which may be quite different in which how the disease behaves in other ethnic groups or other patients with different demographics. So that kind of skews your data and limits your generalizability. The third way is also to reinforce a local bias. So again, remember, when you're looking at national guidelines, that is going to be dependent upon the national prevalent circumstances. There may be some political pressures. There may be some other factors which may be which may cause the national guidelines to be not as robust, sort of creating a medical echo chamber for that particular population. And if you go internationally, you can make guidelines which can be much more thorough. And the fourth point is that rare diseases. So remember that sometimes we have guidelines for rare diseases, and rare diseases are rare, and you may not have a lot of rare diseases in the national population of the country where the national guidelines are being framed. So you have to look internationally. So if you just stick with the national guidelines, sometimes you cannot come up with a good guideline for rare diseases. For rare diseases, you have to include the sample size as big as possible, and sometimes that may not be possible to accomplish at a national level, and you will have to go internationally.